we're talking about tobacco and cannabis, maybe a little bit lighter substances, but almost a lot more common, especially so widespread in our community. So we'll talk about if you use these substances and then also things as community members or family members or friends who are seeing this in our community. Just talk about harm reduction for a second and review that. In our society, tend to feel very all or nothing about things. And we're seeing more and more that that's actually really counteractive, not just with substance use, but really a lot of things like even mental health and your own health stuff. Like even if you don't get vaccines, still important to go see a doctor. So just really centering your own autonomy and all of that. And then we'll talk about tobacco use first, what it is and how it's harmful and how we can reduce its harm. And then the same thing with cannabis use and also the question of is it harmful? Because there's some questions about maybe some health benefits around cannabis use as well. But there are also some harmful aspects to it too. So can we reduce its harm? Having both maybe good and bad properties that applies to a lot of drugs in a way, because a lot of it is about how frequently and how you're using these drugs, how they're available to people that make it harmful. So we'll talk more about that. A reminder that harm reduction is about reducing negative consequences associated with drug use, not saying that we are all going to be okay with drug use and think that it's fine. We understand that there are negative aspects to it and really harmful aspects to it for the individual, for the community, for family members and friends. Our goals are always to reduce the harm it's causing on that person and the environment around them. Then we also recognize that this is really a movement for social justice. A lot of our perspectives and stigma towards drug use has been set in us from a lot of propaganda that has been given to us by our government for many years because of the war on drugs. And it's particularly communities like East Harlem and Black and Brown communities in urban areas that have been targeted and receive way more punishment than other communities and other races and groups. So we really have to remember that in centering and thinking about how we approach reducing harm rather than just trying to blanketly be like, stop doing drugs. We know that's not useful, and we want to listen to the people who do use drugs and respect them and their rights and their autonomy of how they can engage and build a life that is healthier. Obviously, for many people and for physicians, we think that the perfect thing to do is to just not use any substances, including no caffeine, nothing bad ever. But that's just not realistic. We all engage in some vices and things, and we might want to push people to be better, but we have to recognize that we don't have that control over people, and we have to meet people where they are. Even just thinking about there is harm when you ride a bicycle, when you go out in the rain, when you go in a car, when you're standing on the sun, you have risk of skin cancer, of injuries, of getting sick from the rain. And the way that we reduce that potential harm that all these actions can cause us is from using these tools that we have. A reminder of some of the main pillars of harm reduction. It's about minimizing harm, remembering that it's really based in a lot of classism and racism, that we really prioritize the individual's humanity. This is really part of our collective care, and that we're not ignoring real harm and danger about drug use, and that we do not judge, we do not coerce people. We are working with people, and that people who do use drugs deserve a voice, and we're here to empower them and encourage their support. It's very complex, and it's a continuum of behaviors from really severe use to not using at all. But there are definitely safer ways to use drugs than others, and we want people to focus on the safer ways. The overall themes of harm reduction: we want to prevent people from dying, we want to keep people safer when they're using, and understanding that it's not always realistic to want everyone to just stop using. You may want that, but that's just not realistic of how people are. The harm reduction aspect of that is wanting people to be safe when they're using, and then creating and having a range of treatment options, building this trust and community with people so that they can get help, and that can cause a ripple effect in their life of encouraging them to take care of themselves better and seek support in good ways, and then supporting people on their healing journey. There's so many different types of drugs. Even here, we see that caffeine is listed. People often don't always think of that as a drug, but there are a lot of things that really are kind of drugs in terms of affecting our bodies and our minds, even if it might be in more subtle ways. But caffeine is still considered a stimulant. Tobacco, that we'll talk about today, is a stimulant technically, and it may not be as strong as like meth or cocaine, but it is still something that is affecting our body. And then we're going to talk about cannabis. We'll touch on some of these other types of cannabis a little bit, just a reminder that there's very broad, variable drugs and how they affect you. Medications are also drugs. There is a lot of stigma that was put on drugs because it was part of being against a lot of native culture worldwide during colonialism and a lot of Black culture during that same time, targeting those communities. Western medicine, there's still a lot of research being done. Penicillin and like a lot of other medications are derived from Eastern medicine, from the global South, from native and Black and brown communities. There's a lot of research starting with like ketamine, with psilocybin, which are mushrooms, and other medications of seeing like maybe we can actually derive some chemicals and or some of the properties of those drugs, or like use really low doses and see that this can actually be a really safe and non-addictive way of treating a mental health problem. When we think about drugs and when we think about our stigma around it, that a lot of that has been propaganda for how we've viewed drugs because of the war on drugs. And we think that all drugs are bad, but there's really a fine line between medications and drugs and what can be helpful. And a lot of it is based on the amounts and the dosing and people doing the medical research to really get that medication property from the drug itself that can be used in a helpful way for people. But this is also why, because people are not getting the right treatments that they need for mental health, they turn to things on the street. They turn to things available now in dispensaries or other things like tobacco, like coping things to try to help their mind. And that's really kind of a failure of the medical system right now, of not giving people the right sort of treatments that are available out there. Tobacco use is maybe kind of this lighter drug in some ways, but it's still a drug. There's still debate on that because it doesn't quite give you this like high or alter like your brain function so much that you're acting that different, but it does affect your brain and it can give you some like stimulation and a little bit of euphoria that people feel. And it's an important one to talk about because it's honestly one of the most dangerous ones in some ways, because it is the number one cause of preventable death and disease in the US. It causes a lot of heart disease, a lot of lung disease, so much cancer. So this is something that is really important to think about if you use yourself or if you are exposed to tobacco from like secondhand smoking. Cigarettes cause 480,000 deaths every year in the United States, which is a lot. And that's more than any other drug, actually. And it can be as addictive as heroin, cocaine, or alcohol. I have a lot of patients that have been addicted to heroin or cocaine or alcohol and quit, but they find it so difficult to quit tobacco, to quit cigarettes, because it's something that isn't quite affecting your day-to-day life maybe as much, but it's something you're doing like all the time and has become just so integrated in your behavior. So it can be really hard for people to quit. It's really addictive. And often a lot of people do relapse. They might quit for a little bit and then go back. And a lot of that habit is really rooted in feeling like it's a stress relief. There's so many different types of tobacco. A lot of the harms that we're going to talk about are really focused on cigarette use because that's kind of the most common one. But the harms of cigarettes, they're applicable to all of the type of tobacco because most of it is smoked. So I'm going to talk a little bit about e-cigarettes too, which have become very common. Hookah is also another one that is pretty common too, and it can often be really potent. And because the way that hookah is done is like sitting around or like doing it at a bar for like hours, it's kind of like smoking like a few packs in that like 2 hour span because you're kind of just like continuously smoking, and it's very potent. Thinking about the effects of smoking on the body, we know that it causes really bad lung damage. It causes a lot of heart disease and increases your risk of strokes in the brain and heart attacks. It increases psoriasis risk. It causes skin conditions. It hurts your bones as well. It increases your osteoporosis risk, which is your bone density. It can cause fertility problems for both men and women. It delays your wound healing if you get any injuries or scratches or even internal injuries, or if you need surgery. That's like a huge reason that surgeons really want you to quit beforehand, because it can cause problems with the wound healing when you're doing the surgery. And then also when you do anesthesia, because it affects the heart so much, it puts you at a higher risk of problems with the anesthesia. And then it can cause a lot of mental health problems. And then overall, just like cancer everywhere in the body. Also vision changes. Anything that you're inhaling like that can increase your risk of gum disease. And the type 2 diabetes as well. It can really really increase your risk for that. It causes like all of these types of cancers, but quitting can really lower the risk of all the types of cancers that it can cause. Basically, all types of cancers that it can increase your risk for, but especially lung cancer, which is why if you smoke and you're over the age of 50, you do need to get screened for lung cancer every year. Even if you quit smoking within 15 years of turning 50, you still want to get screened for lung cancer at least a few times. Mouth or throat cancer, esophagus cancer, throat, like your larynx, your voice cancer. It could cause lung cancer, leukemia, kidney cancer, and then bladder cancer. And then it could cause cervical cancer as well. Always important to be getting your pap smear for this reason, especially if you smoke. But regardless, every 3 to 5 years, you need to get a pap smear to be checking for that if you have a cervix. And then it can really increase your risk of colon and rectal cancer, pancreatic cancer as well, and stomach and liver cancer too. So all of the cancers. But the good thing about quitting is that your body can really start getting back to normal pretty quickly. So even within 8 hours, you start decreasing some of these toxins of the nicotine and carbon monoxide levels in your blood. Carbon monoxide is a toxic chemical that gets in your blood when you are smoking or inhaling other kind of really bad toxins. So that can reduce by even more than a half, and you kind of clear a lot of that out. Even within 2 days, your lungs start clearing out all the debris. It won't get fully clear within 2 days, but it's already starting to do that. And then you can even notice after 3 days of not smoking that you may be breathing a little bit easier. Like if you try to take a deep breath, you may notice that your lungs can expand a lot easier. And then within 2 weeks to 3 months, your circulation starts improving. Your blood is moving better. There's less plaque buildup, and your plaques are starting to clear out as well. 3 to 9 months, you may have a lot less coughing and wheezing if you had those symptoms when you were smoking. After a year, your heart disease risk is down to half. So it's like halfway to being a non-smoker. It does take like 10 years for you to really decrease that lung cancer risk, which is why you should still get checked for lung cancer, even if you've quit within 15 years and you're over the age of 50. And then after 15 years, you basically are back down to being as if you never smoked with your risk of heart attack. So all reasons to really think about and see that like it's not all gone. Like even as you get older and you're feeling like it's impossible to quit or that you may not really see the health benefits, you will start seeing the health benefits pretty quickly. Your body can really heal itself well. This is also a reminder that tobacco use and tobacco ads are targeting our neighborhoods and Black and brown neighborhoods more than any other. There's 10 times more tobacco ads in Black neighborhoods than in other neighborhoods. This is like why there's so much smoking. There's some similarities of how for a lot of drugs and a lot of like cannabis and tobacco, there's a lot more people selling and wanting to take advantage of that in Black and brown neighborhoods because there's a lot more poverty, a lot more struggles that Black and brown neighborhoods experience. They're a lot more at risk and they're kind of better clients in some ways to using substances. So people take advantage of that to try to get money. That's a huge reason that there's even worse health problems because there are people taking advantage of that. So that's also a reminder of when we see people using and doing these, there's all these bigger factors at play of why people are using. It's not because of that individual person being weak or being like susceptible themselves. It's like our society has done this to people. So remembering to think of it that way. And same thing with tobacco. It really affects the poor, it affects Black people, it affects the homeless, and it affects queer and LGBTQ people way more than other communities. And for young adults, it's becoming even more of an issue, especially with e-cigarettes, where we're seeing an increase in Black and Hispanic Americans that are smoking. In 2023, this increased as well, but there's more of a decrease for white people. It's really going up, and especially you see young Latinos are smoking. There's a lot more increase of a lot of young adults smoking for Latinos especially. And then really seeing that it disproportionately affects LGBTQ adults and young people significantly. And for young people, especially for LGBTQ females that are aged 14 to 17, they're 3 times more likely to use cigarettes and cigars than straight people, twice more likely to use e-cigarettes. And it's especially higher for transgender adults, but still also higher for LGBTQ adults compared to straight adults. For LGBTQ adults, they're nearly twice as likely to use e-cigarettes and the little cigars. And this is all taken from the Truth Initiative. If you want to learn more about some of the disparities, the inequalities between different groups. So how can we quit? And how can we encourage other people to quit? quit. There's a lot of different options. There's patches, gums, lozenges, sprays, and inhalers. And then there's also medication. A lot of people have maybe tried quitting, or they've tried like the patch or the gum or something, and they're just like, it didn't work for me. You want to kind of do multiple things, especially if you've tried to quit before with one and it hasn't worked. If you've tried nothing before, then starting with like the patch, and remembering too that these come in different doses. The gum lozenges come in like 2 milligram or 4 milligrams, and those are ones you can kind of take throughout the day. You can do the patch and then do the gum and the lozenge on top of that when you're feeling cravings, is what we encourage people to do. These are all nicotine replacement. So it's giving your body a little bit of nicotine, not quite as much as before, and it's a lot safer and it really helps you quit. But quitting cold turkey can be really hard. Some people do it. Some people really feel motivated. Like, that's awesome if they feel like they can do it. I think that it's really hard to do that. And it's because your body gets so dependent on nicotine, especially if you were smoking like half a pack a day or like over half a pack a day. Your body like really will need nicotine, and it's going to be so hard to not submit to that craving if you don't give your body some nicotine. You definitely want to try to give your body something, or at least have something on hand in case you do feel like that, even if you want to quit cold turkey, to just have something. And patches, gum, and lozenges are pretty available with Medicaid and insurances. Inhalers and sprays are sometimes not, and that's something to talk about with your doctor. And then there's medications that can actually be really helpful. A lot of people get really good experience with Chantix or varenicline, because that is a pill that starts making the cigarette kind of taste bad. It takes a few weeks to start working, but it can really help. And then bupropion is another one, especially if you have anxiety, that can also help with the anxiety as well as quitting and stopping the cravings. For people that are trying to quit, it's really most important that they're thinking about setting a quit date, or at least like how they're going to cut down and when, and trying to get some of their community involved, their family, friends, coworkers, to say that they're doing that, to keep them accountable. And then think about the challenges they're going to face while quitting, like feeling those cravings, and whether they're going to take some nicotine gum or lozenges, whether they're going to do medication, if they're going to quit cold turkey, what are they going to replace it with? Are they going to try to go for a run or something? Are they going to try to snack on just like normal gum or like a candy or something? And obviously we want people to not replace nicotine with bad eating, which is very common, but we still think that's kind of harm reduction in some ways, because even bad eating is not good. Like, eating junk food in replacement for smoking is not good. We don't want that to be the goal. But if someone is really like, I'm at least not smoking, but I'm eating more now, that's still decreasing their risk for heart and lung disease and a bunch of cancers. Then we could start working on the nutrition part of it too, once they feel like they're in a better place with smoking. But we do want people to try to replace it with healthier things first if they can. That's a lot more of the goal of using like the nicotine patches, the nicotine lozenges and gum, or medications, or really thinking about filling that time with other things, at least trying to do it with sugar-free gum or doing some other sort of activity to kind of distract themselves. And we really want to encourage people to talk to doctors about getting help to quit. There's also some other resources like these. So the New York City Department of Health has a lot of resources. You can call or text for mental health counseling, as well as tobacco use counseling, these numbers. You can start thinking about a money jar. Cigarettes are so expensive, so you start saving so much money as you quit. And that's a huge way to start encouraging yourself to quit, is like putting money in a jar of what you would have spent on a pack of cigarettes. And really thinking about, if you're bored, a lot of people smoke out of boredom, finding a hobby or exercise, puzzles or games at home, doing something different. And then obviously we said we want to do healthy snacks or drinking some water. A lot of people smoke like right after their coffee or right after eating a meal, maybe trying to brush your teeth or getting gum or like normal gum or something if you don't want to do the nicotine gum at that time. And then just like thinking about other options like stretching during breaks, and then trying some relaxation techniques if you're feeling stressed or anxious, calling a friend, going around places where smoking isn't allowed, like restaurants or movies or cafes, telling your support groups that you're trying to quit. The New York City Department of Health website has some resources like worksheets and things to go through, and numbers, a lot of different languages to call. There's also Nicotine Anonymous, that are a group groups that are online mostly. There's not many in-person meetings compared to like Alcohol Anonymous. Those ones you can go on the internet and see Nicotine Anonymous. There's a ton of meetings every day to hear other people's experiences and be part of a different community of people who are also struggling to quit or have quit and get encouraged in that way. Making goals is the biggest thing. So in terms of encouraging others, trying to minimize your risk of exposure, you want to encourage smokers to smoke outside, to change their clothes when they come back inside, especially if there are children in the house, because we know that it can increase the risk of asthma for kids to be exposed to that smoke, especially in Harlem because it's in our air a lot. Talk about other options on cigarettes with people. And even thinking about if it's cigarettes, there is this idea that e-cigarettes actually may be a harm reduction tool. Right now, for what we see, there's less risk of lung cancer and heart disease with e-cigarettes. It's still harmful though, so we don't want people to get dependent on that. But if that's going to be this bridge towards quitting, that still may be a better option than just cigarettes if they've tried everything else. We want to try the main medications and the patches and gum and lozenges and all of that first. But if they're really struggling, then we can maybe consider e-cigarettes. Nicotine pouches are a new thing that's becoming really popular with a lot of young people. Those come in really high doses. They're not medications. They're things that you buy around, and they can come in high doses and aren't necessarily safe. And there's questions about the flavoring being safe too. So we don't really want to encourage that. But again, if it's something that people are really struggling with their cigarettes, have tried everything, feel like there's nothing, and they are so unmotivated to try anything again, then maybe they can think about nicotine pouches. But trying the lowest dose of 2 milligrams or 4 milligrams. I don't even think they come in 2 milligrams. It's like 4 milligrams to like 20 milligrams, and 20 milligrams is like a crazy amount. So trying to do the 4 milligram ones and doing that instead can be an option. But those are things you have to buy. That's not a medication that's approved. Best treatment is nicotine replacement or medication. So really focusing on that. And then encouraging people to look at some of the tools that the Department of Health website has of just like writing down some of your goals, thinking about what your goals are, where you want to be, why you want to quit, thinking about how expensive it is and how much you're going to save, using a money jar and all of that, and finding replacement habits like exercise or different hobbies like puzzles or art or something. And remembering that it's really hard to quit. It's a very individualized process, which is why it's good to talk to your doctor and think about what's right for you. Do you want to cut back? Do you want to set a quit date and say, I'm going to be done after that? That really depends on the person, on what feels right and will feel sustainable. And so now switching to cannabis use we see so widely in our community. So there's so many different types of cannabinoids. This is just showing what is in cannabis itself. So the main things to know is there's CBD and there's THC. THC is the one that makes you high, that gets in your brain and makes you high. CBD, it can help you with like anxiety and things, but it doesn't give you a high. This is what is sometimes encouraged to use, and it's been available more even before marijuana was legalized in New York. It was available as oils or as like options to use for anxiety or for pain relief, and it can be a potentially good medication. We'll talk about CBD in a second too, but remember that there's these two main things, and there's also these other chemicals that are in cannabis, and not all cannabis is the same. It's very variable of what the experience is that people have with each kind of flower that they get. Generally talking about how cannabis is used, it can be smoked with a pipe or bong or rolled into a joint like we see here, and you feel the effect really quickly when it's smoked because it gets directly in your lungs, like exchanging your oxygen and everything into your bloodstream directly. So this is why it gets into your blood and then it goes up into your brain pretty quickly. So you feel it pretty immediately. And same with vaping, because anything that you inhale, you're going to feel pretty quickly. That goes for any drug. But for eating it, because that's going into your digestion system and takes some time for your digestion to work, it's going to take a longer time to feel the effect. And then vaping, it uses just the THC oil. So it really doesn't have like cannabis. For smoking it, like the pipe, bong, or joint, those are usually crushed up leaves that are rolled up. So it has all these chemicals in it. This is talking about the natural chemicals found in the cannabis plant. We're not really talking about synthetic cannabis, which is something that we should really discourage in general, is really unsafe to do and can really cause a lot of harm. Just to keep in mind of that, because things made in a lab are usually not reliable. And for synthetic cannabinoids, they can be very problematic. So these are the ways that cannabis is used. How it makes you feel really depends on the person, and it depends on the type of cannabis. Sativa and indica are the ones that are common commonly talked about. I think there's a third one as well. So there's those different kinds. And some people say indica makes you really relaxed, sativa makes you more excited. In reality, a lot of the cannabis plants are all kind of mixed together a lot. So there's not really this like set kind of sativa or indica plant anymore, the way that manufacturing has been. And they still say it on the label. They really just label that based off of the experience that people have. So there's not really that regulation of which plant it is, because a lot of the manufacturing of these plants have just become so intertwined, those species. So most of them are really technically hybrids is what they are, but based on just what kind of high people get, they label it as like, oh, this is more of an indica calming one or more of a sativa activating one. Sometimes they'll say how much THC and CBD is in each plant, and the CBD is considered to be more of this relaxing type of chemical, and the THC is more of this like stimulating type of chemical. But that really varies on just how people are experiencing things too. The range of how people feel from cannabis is relaxed and happy, feeling euphoric, to feeling like someone's giving you a big hug, but then it can range to feeling very anxious and very paranoid. So there's a huge range of how people feel. The risks of cannabis use, so brain development is a huge one. This is why we really want to discourage younger people using it before the age of 25, but a lot of people are going to be using it regardless. So this is also why we want to think about harm reduction with cannabis use. If people are going to use it, how we can limit the harms that it can cause. For even adults, it harms memory and brain function, the cognitive function. It can cause paranoia, and because of that, it can sometimes increase the risk of schizophrenia, and that's even a higher risk if it's a synthetic cannabinoid. It can increase the risk of other mental health issues like depression and anxiety, which is kind of ironic in some ways because some people feel like they treat it for their anxiety and it's the only thing that helps with their anxiety. But long term, we've seen that it can actually make your anxiety worse, and it can cause addiction. People can get dependent on it because addiction is about just feeling like you are using a substance so frequently that it's actually affecting your life in a negative way. So sometimes it can get to that point of where it's really affecting your life in a negative way. A lot of addiction for cannabis use can look like, I don't want to say laziness, but it can kind of look like tiredness and like not really being as motivated to do work or to engage in the world. It can also increase your risk of heart and lung disease is what we're seeing. It is less harmful than cigarettes, but it's still harmful. Sometimes we think maybe if something is less harmful, that maybe we can do that. Again, harm reduction is this very broad, flexible thing where it's like, okay, if I have a patient that is smoking 2 packs of cigarettes, but then they are like, I'm going to switch to smoking a joint a day, I think that's better. But I do want them to get off of smoking a joint a day and want to see how they can try to limit that as well and how we can start reducing the harm of that. But it's still good. That's still something to be like, that's good that they at least stop smoking 2 packs a day, because that's way more harmful for their health, their heart and lungs than a joint a day, technically. But a joint a day is still harmful. And then there's a possibility that it can cause maybe some throat and mouth cancer, but there's not really a lot of evidence on how it can cause cancer. That's still kind of up in the air. There's a worse risk with all of this if you're smoking it versus doing edibles. In terms of reducing the risks for cannabis use, a lot of people mix cannabis with tobacco, and that's really harmful. So we really want to discourage people from doing that, trying not to do that. Some people may be like, this is what I'm doing and I'm not going to change that. And this is also why we just talk about what is feasible for them to do rather than being like, well, you shouldn't do that, because maybe they shouldn't, but they're not going to change it. So how do we get them to be a little bit safer with how they're using? So we really want to at least say, well, don't roll your joints with tobacco, at least smoke them separately. And then don't hold the smoke in your lungs. People think that like inhaling it and holding it in your lungs will get you more high. It does not. The exchange in your lungs happens really quickly. So you only need to just breathe a normal like inhale to get that high or to get that exposure to the cannabis. So don't hold it in your lungs, because that smoke, if you're holding it in your lungs, you're getting more exposure to the harmful chemicals rather than the cannabis drug chemicals. So don't do that, because that can put your lungs at more risk. And then not using a cigarette filter for a joint. You're supposed to use a folded up paper as kind of the filter, because cigarette filter for some reason is actually like more harmful for cannabis leaves. It's fine for tobacco leaves, but for cannabis leaves, it's actually worse in what you're inhaling. And then when you're rolling a joint, only using one thin paper rather than multiple papers or thick papers, because then you're burning a lot more paper and you're burning burning more paper into your lungs. And the burnt paper toxins are actually almost more harmful than the cannabis flower. Using reliable dealers or dispensaries, which is also hard for people because dispensaries are expensive, but really trying to encourage people and to use dealers that they maybe know or that give safer cannabis. And then considering smoking only CBD. So there are some places that will sell just the CBD joints, and that's safer and better than doing the normal cannabis. Also, doing edibles is a better way to avoid the lung and heart damage. This is kind of harder sometimes for people because the CBD joints and edibles can be a little bit more expensive because edibles can also be more potent, that maybe it can last them longer too. About CBD oil, like I mentioned before, there are actually likely health benefits for CBD oil itself and hemp. Hemp and CBD, they're parts of the cannabis plant that don't have the THC and the like highness effect. So it doesn't give you a high effect, but it still may actually calm you down a little bit. So it can calm your anxiety and also can help with sleep and also with pain. There's studies that have found that they may be possibly anti-inflammatory and antioxidant. It can help with like migraines, nausea, and digestion. Still needs more research, but there's minimal harm. For cancer, it may be good to help symptoms with terminal conditions. A lot of people have found that it can help with pain relief, nausea, vomiting, help stimulate appetite, decrease anxiety, and sleep. But just to remember that unfortunately, medical cannabis in New York State is not cheap. So you can get a prescription for it, but it doesn't really give you that much of a discount compared to dispensaries. If you don't smoke, because it's in the air so much in the city, just thinking about minimizing your exposure with like air filters, doing deep breathing exercises. The yoga exercises of deep breathing really strengthens your respiratory health so much and can strengthen your immune system a lot. So trying to do some deep breathing exercises every day for your respiratory health and then also for your mental health is really good practice. It really teaches your body to start clearing out some of its toxins. Then really following good lung hygiene, getting vaccines, masks, and hand washing and sanitizing will decrease your risks that come with exposure to cannabis and tobacco use in the air. Cleaning your air vents in your house, even the window vents too, and making sure there's not too much toxins coming in that way. Checking air quality online too, just what the air quality is looking like if there's other things going on in the city. Quitting smoking is such a huge feat. Making those goals so amazing.
I think it was helpful for you to talk about it as like a recurring condition too. I think if people think about it like that, it feels like you keep trying as opposed to it like, oh, I wasn't able to quit, so I can't quit. It's like anything else. You have to keep treating it until it really is in remission or whatever you want to call it at that point.
Yeah, you just want to keep making sustainable changes and think about your relationship with it and how you can keep cutting back. There's a lot of options, a lot of ways to try to tackle it. So even if you've tried before, there's new ways to approach it.